So if you're anything like me, you've had to deal with acne at some point in your life. It's a constant battle, trying not to block your pores, trying not to squeeze those pimples, and then having to deal with those scars afterwards. In today's video, I'll be covering some of the myths around acne, what the common causes of acne are, and of course, the best treatments to get rid of acne. Welcome to my channel. I'm Dr. Sabana. I've been a medical doctor for nearly 20 years, specialising in skin and aesthetics. Make sure you watch to the end of this video to find out my opinion on the top 5 most effective treatments for acne. There are so many myths surrounding acne, and I want to clear up a few things that people often get wrong. The first myth is that acne is due to being dirty. This is not true. So over-cleaning or scrubbing your face too much won't make the acne go away. Harsh scrubbing can actually make acne worse by damaging the skin barrier and increasing inflammation. Obviously, not washing your makeup off or using dirty makeup brushes can make acne worse. The second myth is that blackheads are dirt in your pores. And no, this is not true. That dark colour comes from the oil, the sebum in your pores, being oxidised. It's not dirt, and scrubbing won't make it better. The third myth we often hear is you need to dry out your skin to get rid of acne. Actually, over-drying your skin can make oil production worse. A healthy skin barrier is key, which is why I sometimes recommend patients to really minimise their skincare routine and strip it back to the basics. And the last myth is acne is just a teenage problem. Definitely not true. Adult acne, especially in women, is really common and is often hormone related. It's one of those common complaints I see in perimenopausal women. So what is acne? Let's start with the basics. Acne happens when the small hair follicles on our skin, what we call pores, get clogged with oil, dead skin and debris. We all have tiny oil glands which help to keep our skin lubricated. These are called sebaceous glands. They produce sebum to keep our skin hydrated. But sometimes these glands become overactive, producing too much oil. When the excess oil mixes with dead skin cells and bacteria, it creates this perfect environment for inflammation, leading to bumps, whiteheads, blackheads, and sometimes painful spots. And this is all referred to as acne. Now, not all acne is the same. There are different types, and knowing which one you have is key to treating it properly. There is comedonal acne. Comedones are basically small bumps that appear at the opening of our hair follicles. These can be either blackheads or whiteheads, or a combination of both. Blackheads are referred to open comedones. These are clogged pores which are open at the surface of the skin. As the pore is open, the oil oxidizes and it turns black. Whiteheads are closed comedones, and these are little bumps trapped under the skin, usually filled with thick white stuff. Then there's inflammatory acne. This is when bacteria gets involved, causing red, swollen, painful spots. They can be papules, small red inflamed bumps, or pustules, where the papules are basically filled with pus in the centre. And then there's nodular and cystic acne. This is what I class as the most severe type. You get a combination of nodules, which are large, hard, painful lumps that appear under the skin, quite deep under the skin. And then there's also cysts. These cysts are even deeper than the nodules, and they're often pus-filled. Cystic acne is more likely to leave scars. So what are the causes of acne? The most common cause for acne is hormones. Our teenage years is the worst for this. During my teenage years, I had these annoying tiny bumps on my forehead. They were just under the skin and you couldn't squeeze them out and you couldn't cover it up with makeup. That lasted a few years. And then there was me thinking, I'm done. But then perimenopause hit me and now I deal with red, tender lesions on my cheeks. Often hormonal acne at this stage in our lives appears over the cheeks and chin area. Certain medication can also cause acne. Some forms of contraception, the depot injection or contraceptive pills, can trigger acne. Testosterone replacement, whether that's oral form or injections, can also trigger acne as well. As with most medical conditions, stress and diet can be a major risk factor for acne. Diet is one of those controversial topics. You'll have one group of clinicians adamant that diet has nothing to do with acne, and then the other half that feel diet plays a major role in managing acne. Personally, I think there's a lot we don't know. We are still learning so much about the gut microbiome, and I think when we find out more, we will see how this is linked to not only skin conditions, but a lot of other medical problems we see. I always find it useful to get my patients to keep a food diary. I get them to keep it for 4 weeks and track their symptoms along with everything they eat and drink. Some of my patients have found a link to dairy, especially eggs, and some to sugar. In teenagers, I've noticed a sudden consumption of whey protein has worsened their acne. If you've struggled with acne and a particular treatment has worked well for you, then let me know in the comments below. So what's the right skincare routine for acne? A simple, consistent skincare routine is crucial. And here's what I recommend. So start off your morning routine with a gentle, non-stripping cleanser. I often tell patients that you can just wash your face with warm water. Avoid hot water as this strips off your natural moisture, and avoid harsh scrubs. Follow this through with a light oil-free moisturiser and then definitely SPF, so sunscreen. Your evening routine should also include a cleanser, and maybe you can include something with an active ingredient such as salicylic acid. 2% is a great starting point and it will clear and unclog those pores. After cleansing your face, follow this up with a treatment that contains an active ingredient. The active ingredient is what's going to help manage your acne. I'm going to cover this in a bit more detail later on in this video. And then follow up with a moisturiser. Always use a light moisturising lotion or a cream. Hydration is actually key, even in acne-prone skin. So what are the best treatments for acne? The treatment options for acne really depends on the severity. If you have mild acne, where you have occasional spots popping up from time to time, you can manage this with over-the-counter treatments. Whereas if you have moderate to severe acne, which is quite painful, then you need to see a specialist and get some expert help. To be honest, I don't categorise the patient based on their acne symptoms. Acne can have a huge psychological impact. In some people, mild acne can affect their confidence, and in some people where you've got severe acne, it doesn't bother them at all. So my treatment plan always depends on how much it's impacting them on a day-to-day basis. So when you come to see me for a consultation, I will always ask you to bring in all of the products you're using. If you suffer from acne, I can almost guarantee you're using a long list of things. Having acne is frustrating, and you're constantly on the hunt to find that miracle cure. It doesn't help that every influencer you follow is recommending a new product each week. So you just end up buying one product after another and nothing seems to work. So what should you try? So if your acne is mild, a simple skincare routine, as I mentioned earlier, should be enough. And make sure it has the right ingredients and it should be able to control things. Look for products that include ingredients such as mandelic acid. This is great if you have sensitive skin, mild acne and some pigmentation. As it's less irritating, it's great to be used on skin of colour, as there's very little risk of irritation and then therefore post-inflammatory hyperpigmentation. 2% salicylic acid is also another option. It's great in your face wash or mixed in with your moisturiser, as it can help to declog the pores. And then there's niacinamide. It's literally in everything these days. It's great at reducing inflammation and improving the skin barrier. Just remember, whatever active ingredient you choose, gradually build up the use. I always recommend applying it at night and start off with just once a week, then gradually increase it to 3 to 4 times a week to see if your skin can tolerate it. And then if you can, or if you need to, you can increase it to every night. For moderate to severe acne, we need to step it up. You need to consider prescription-only medication, as this will really help to control the acne. These are my top 5 prescription medication. First is retinoids. This is the gold standard for acne treatment. They help to unclog pores and prevent new breakouts. Common ones include tretinoin and adapalene. Number 2 is azelaic acid at 20%. This is another prescription treatment that can help reduce inflammation, help to control the bacteria on the skin, and also help with pigmentation. Just remember, with topical treatments, you need to apply it all over the affected areas and not just on the individual spots, as you're trying to also prevent breakouts. Number 3 are oral antibiotics. This is great for inflammatory acne. Courses of antibiotics like lamicycline or doxycycline can calm things down. These are used to reduce inflammation. Be aware, these are usually a long course and can be between 6 months to 12 months depending on how you respond to the treatment. Number 4 are hormonal treatments. In some women, treatments like certain contraceptive pills, birth control pills, or spironolactone can be game changers. especially helpful if you suffer from polycystic ovarian syndrome or acne due to menopause. And number 5 is isotretinoin, also known as Roaccutane. For severe acne, this is a powerful oral medication and it can be life-changing for a lot of people, but it's only prescribed when other treatments haven't worked. In the UK, it can only be prescribed by dermatologists. Roaccutane works really well for acne, but it does come with its own issues. Given that it's so strong, Roaccutane can cause extreme dryness to the skin, flaking of the skin. It can also affect your mood and in some patients has triggered depression. And if you fall pregnant on Roaccutane, it can be quite dangerous to the fetus. So it involves a lot of monitoring. And this is why it's prescribed and monitored by a dermatologist. So here are my 3 final tips. The first one is be patient. Acne treatments take time. They often take 6 to 12 weeks to show any real improvement. Stick with it and don't keep chopping and changing the treatments. Let the active ingredient do its job. 2, don't overdo it. Too many active ingredients can irritate your skin and make things worse. So really go back to basics and keep your skincare routine to a minimum. And as I mentioned earlier, gradually build up the use. Number 3, see a professional. If your acne is scarring or really affecting your confidence, don't just wait. There are some great treatments available. I know how frustrating acne can be, but the good news is that we have more effective treatments than ever before. I've created videos explaining the various acne treatments in much more detail. I'd recommend watching this one first. It's about mandelic acid and how it's great for acne.